Today I'm going to be talking about Neuroemotional Technique, which is a treatment that I use in my practice. And for instance, an example of when I would use this in my practice is if someone comes in and they're experiencing physical problems. Let's say they're having headaches or they're having loss of sleep and things like that, but at the same time they're experiencing an emotional problem in their life, and that could be something like they have lost their job, which is certainly very common in our society today, or maybe they are in the middle of a divorce, or any kind of problem could be happening. That could be, so they're experiencing physical sensations as well, and they also are experiencing a kind of extreme emotional problem. So basically, what we do to begin the treatment is we have the patient make a positive statement about their loss or whatever the emotion is. Let's say they've lost their job, so they would make a positive statement saying, "I'm okay losing my job." And at that time, I muscle test them, and of course the muscle is always weak because their inner body, their inner spirit is not congruent with that statement. You know, it's always going to show up weak. So after we've established that this is true, that this is an emotion that they need to work on, then we try to find the meridian and organ front points on the body that relate to the emotion that they're experiencing. And it could be any emotion. They could have anger, which is an emotion of the liver, because they've lost their job. Or they could have grief, which is an emotion of the lung, because they've lost their job. Or they could have low self-esteem because they've lost their job, and that is an emotion connected to the spleen. So we ascertain what is the primary emotion, and at that point we begin to have the patient focus on that emotion. So let's say, how are they angry because they've lost their job? So I have them talk to me and give me a description, an explanation of why they're angry and who they're angry at and how it makes them feel and all that. And then what I do is I go back through their time, through their years of their life, to find out when there was an initial generic emotion of an extreme anger due to a loss. So let's say that we find that at 5 years old, this person, as a child, had to move. The entire family uprooted, and they moved across country or something, and so he lost all of his friends and everything that he was familiar with, and he wound up going to a new school. And what happened is he had a lot of anger about that. So what we do is, the point of this is that anger has been stuck, and it's creating putting a kind of a charge on every time he's angry about a loss in this present adult stage. So what we want to do is have him focus on this early anger at that 5 years old, when he was so angry at his parents for taking him away from everything that he knew, everything he was familiar with. And so what we do is have him explore that whole situation, and we talk about everything, and we do some palpations on the back. It's a very simple, non-invasive treatment. And then we're able to go back to his original statement, which is, "I'm okay with my job loss, or losing my job." And when we muscle test, the muscle holds strong because he's been able to work out that emotional conflict that he had. I want to say that this is not a substitute for a psychological therapy or psychiatric treatment. This is an adjunct type of treatment that many therapists use, also many other healthcare practitioners, because I'm an acupuncturist and I've been trained in this and certified, and I'm able to do this. But again, we don't want to say, stop going to your therapy and just come and have neuroemotional technique treatments. Thank you.